All right, thanks, Travis. The other thing I'd comment just briefly about the capabilities-based planning, where that will come into play is when we do exercises. Oftentimes when we do exercises, or most of the time, we base our exercise planning on some type of capability. And not to muddy the waters tremendously, but there's a couple of different capabilities. Unfortunately, our federal partners haven't come in complete alignment yet. And so we've got the hospital preparedness program, healthcare preparedness program that Travis talked about. And then from the FEMA DHS side, there's core capabilities. And those become important when we're working with our jurisdictional partners or our regional partners. So I'm going to try to stay very high level on hazard vulnerability assessments, threat and risk assessment, and then Dean is going to dive pretty deep and specifically into a hospital. But I do want to ask briefly for those in the audience, is anyone represent an organization outside of Spokane? And I know we have a couple from Idaho and Whitman County, but there's a couple faces I didn't recognize. On GoTo, do we have a couple from outside? Okay, and the reason I ask is because I'm going to try to take a regional perspective and share some information that I've been involved with in the past. And the big idea is really to say that the foundation of all planning is really based on your threat and risk and your hazard vulnerability assessment. And I'll talk with a later slide about some different terms that are out there that really all say the same thing, but in our lust for acronyms and different things and all the different organizations we work with, unfortunately, we're not all standardized, so there's a bunch of terms that kind of talk about the same thing. So to get started, this will be appropriate when we get the answer to this. Does anyone know the significance of today? Not my birthday. That's appreciated. Thank you. Happened a long time ago, 317 years ago. Come on, people. What was that? Cascadia. Cheryl, nice job. I should give you a prize. Yeah, so today, coincidentally, is the 317th anniversary of the Great Cascadia earthquake. Why do we care about that? Cheryl, you can't answer this. You've already won your prize for the day. It's overdue, absolutely. It's arguably the greatest threat and risk, I believe, and I think a lot do believe, that the west side of the state, and I think we face on this side of the state to include North Idaho and to include really our nation. The scientists do tell us it's long overdue, and so I think it's important to kind of memorialize things, remember anniversaries, you know, dates like that. It's not my birthday. I'll remind you in March when it is, Adam. So you can get me something. But yeah, keep in mind that today is the 317th anniversary. Cascadia, I'll talk a little bit about the earthquake threat. I know a lot of people on this side of the state, when we talk earthquake, they're like, it's a west side problem. It is not just a west side problem. So getting kind of to the specifics of why we do this, it really helps us prioritize our planning. What I like to talk a lot about from an emergency management standpoint is the HVA for us in the hospital, the hazard vulnerability assessment, HIVA that the community and the county is often going to talk about, hazard identification and vulnerability assessment, and there's some other terms that I'll talk about later that, again, all say the same thing more or less, are talking about threat and risk. But your planning at your organizations and facilities really should be based on an annual review that you do. And so the other thing that is cool for this meeting, and I just realized that as Travis was talking, and I'm thinking about my presentation and Dean's presentation, is one of the things from a regulatory standpoint, and I really hate to be very regulatory focused, but in hospitals I've learned in the last year and a half, just a little bit important, if not very important. But one of the requirements we have is that we talk with our community partners about our threats and risks. So please, everyone, recognize and note when you get a surveyor and you're going to be assessed, especially for hospitals, and especially now those additional 17 suppliers and providers, this is a forum where we talked with our community partners about our threats and risks. And this should inform the HBA or the threat-based planning that you do in each of your facilities. So as we talk about hazards and risks, just to kind of ground us a little bit, Dean's going to dive specifically into how the hospitals do it. I'd love to say they're all standardized, but even across Providence, we're not standardized. But we do all use some variation of the tool that Dean's going to show us. It's a Kaiser model. I'll show you kind of where you can get that resource. Kaiser Permanente, one of the larger healthcare systems. They've actually done some great work, and they share all their products. And most all of us use some variation of that with our annual HVA reviews. But as we talk about hazards and risks, this is a couple of examples of them here. And so if you think about it in the context of your organization, the communities we live in, you know, think about those natural hazards and then those risks that we face. And, you know, certainly movie theaters, hospitals, malls, large public gatherings, what's a common theme for all of those that we don't see on this? Actually, we do. Sorry. Active shooter. Yeah, they are certainly at a greater risk. So that's kind of a broad definition stroke of that. So I put this slide together shortly after I got to Providence. I call it my hazard du jour slide. I don't want to spend a ton of time, but really for our community in Spokane, this kind of covers most of the threats and hazards that face us. Certainly not all of them. There's interdependencies among the different ones. But, you know, just to kind of walk you through this kind of left to right clockwise, you've got the KC 135 crash at Fairchild a number of years ago. The slide to the right of it, can anybody see that well enough to know what that's depicting? No, it's not clear. So it's supposed to depict cyber. And so hospitals certainly are very cyber dependent. Devin talked about Deaconess's transition to Epic. Providence uses Epic already, but I can tell you when we lose Epic, our electronic medical record system, unexpectedly, it causes us great grief. When we plan for it, we do a little better, but it usually still causes us great grief. And so then you've got the snow, which we've seen in spades this year. It's caused us a little bit of problem, not near the problem that it caused our partners over in Portland and Vancouver in that area. The annual wildland fire, we've got windstorm last year, ice storm. The bottom right, you've got OSO, the now famous backpack from the MLK Day, and then this slide, which is the map of the Pacific and the Ring of Fire, which is that Cascadia earthquake. So I think pictures sometimes can help us put threats and hazards in context. So now I'm just going to walk through a couple of slides before I transition to Dean kind of quickly here. A number of years ago when I was in my previous position as regional coordinator, we put together a threat and risk assessment and then a strategic planning process. What I truly believe is that the planning process is where most, if not all, of the knowledge is gained. Plans are really not that valuable to us because most of the time we don't look at those plans. But the planning process, the discussions we have with our partners, really is where we learn so much. So I simply want to make everyone aware that there is a regional threat and risk assessment. More importantly for each of us, there is a jurisdictional. In most cases, it's at the county level in Region 9, as well as in North Idaho. And we should be reaching out to our jurisdictional partners primarily through emergency management to ask what those are. So the regional hazards, as we looked at them from the broad regional standpoint, and some of this was just kind of a count and both a qualitative and quantitative assessment. No surprise that all 10 of our counties identified wildland fire, and then as you go down the list, 3 identified Columbia Generating Station as a threat and risk. Now, interestingly, all 3 of the counties that identified the Columbia Generating Station as a risk are not all actually affected by that hazard, but there is a perception of risk, and that sometimes is important to know as well. And then some of the other hazards that are on there, again, the frequency of which, you know, we get wildland fires every year in this area. We get snow and winter severe weather. We've overdue for the earthquake. I think if we were to talk about earthquake hazard now, keep in mind this was done in the 2012 timeframe. I think if we asked this, if we did this assessment again, I think every county would certainly say earthquake is a hazard that we should be concerned with. And then in Spokane County, infectious disease. What's the health district grappling with here in Spokane right now? Which one? Or which ones? Mumps. Yeah. What else? Flu. What else? Norovirus. Yeah. So lots of stuff. The health district is getting worked right now. Yep. So then probability occurrence. This is where it gets almost voodoo magic. I don't want to go down the road that many people are starting to talk about. I heard this in a meeting yesterday. Everybody's starting to coin alt facts. I wouldn't say that this is alt facts at all, but it gets kind of squishy as we talk about probability of occurrence. But the long and the short of it is here. If it's an A in this assessment we did at the regional level, it happens annually. B is 1 to 10 years, C is 10 to 50, and D is greater than 50 years. And there actually was some quantitative data associated with that. And then this is the wonderful matrix that we put together, kind of the color coding process. So red is worse and green is less. I can tell you I spent way more time probably in meetings talking about moving things around. But does this more or less look right from what we see on a regular basis and the threats and hazards that we face regionally, recognizing that it varies a little bit. If you're in the rural areas of Spokane County or Region 9 that's more prone to wildland fire, you might say, well, wait a minute, that should be bottom left corner red because we have it every single year. But as you look at kind of how the federal government quantifies these values, and it's often with loss of life, that's where some of the threats and hazards get prioritized lower than we might assume. So then just real quickly, Travis was actually, both Ed and Travis talked about the new CMS rule. Really important that we understand that. We're still trying to get a better understanding of it since the guidance just came out this fall and CMS hasn't released their interpretive guidance yet. But jurisdictions do these things. Ed mentioned to me before the meeting SAIRA. That's a term that you might start hearing more and more. Spokane County and Washington State and the urban areas, so Seattle and Los Angeles and Boston and Chicago and those large areas have done these. SAIRA is really just another HVA, but it's threat and hazard identification and risk assessment. It's a very detailed process. I understand that the VA is going to embark on this, and I don't know if Chris is on GoTo or not, but I think Chris at the VA is going to embark on this, and I'm sure we can all learn a little bit from him, as is Spokane County. I shared with you the regional one, which we did a few years ago, which is a reference point. The states do one every single year. The state one is typically called an HIVA, Hazard Identification and Vulnerability Assessment. And now these additional suppliers and providers are also required to do a threat-based planning and have an emergency plan and things like that. So real quickly before I transition to Dean, Cal Hospital is one of the more progressive state hospital associations, and I simply wanted to share this with you, and the website is here and these will be shared with you, but especially for those suppliers and providers that may not have done HVAs before, I think feel free to reach out to any of us in the hospitals or jurisdictions that have done these. We'd be happy to share with you templates and things that are out there. But if you go to this web page, there's some really good information and resources here, some of which you've got some handouts. And so as Dean goes through his presentation and shares kind of how the process that they went through at Deaconess to do their annual HVA review, I'd suggest maybe looking at that 2-page document front to back that you have and listening to him, and hopefully having that help you better understand how the process works. So, Dean, I'll turn it over to you unless there's any questions.